Dr. Amit Kumar, who will be speaking to us on research and publications, the need of the hour.
Very good afternoon to all. At the outset, I'd like to thank the organizing committee for giving me this opportunity. So I'll be talking over the next 10 minutes on research and publications. Why is it important for the residents as well as the faculty? So what is research? We'll see. Research is a systematic process of investigation that involves collecting data, documenting information, analyzing and interpreting the data. Research can be simple, like answering a question that already has a known answer, or it can be more broad, like answering questions that have never been asked. So there are various dimensions of health research. It can be a theoretical research like literature review, which most of the residents do during their thesis presentations or protocol preparation, or applied research where you tackle a real world question and attempts to solve a problem. It can be a preventive research like dealing with vaccines and screening tests, or therapeutic research like RCTs and drug trials. It can be bench-based or laboratory research, or a bedside or clinical research. It can be exploratory or a confirmatory research, or it can be an implementation and translational research. So research always starts with a research question. So what is a research question? It's uncertainty about something in the population that the investigator wants to resolve by making measurements in the study population. So uncertainty gives rise to data needs, and research question, we should remember, should be very clear and unambiguous. So whenever you want to do any research, we should know what are you going to study. So the research question should be very clear and unambiguous. So it helps to choose the most optimal design for the study and identify who should be included and what the outcomes should be and when the outcomes need to be measured. So if we have a research question like what are the outcomes of diabetic vitrectomy and their predictors. So here who should be included? We will include the patients who have undergone diabetic vitrectomy. Outcomes, we can look at the vision outcome or the retinal attachment outcome or the complications. And when the outcomes to be measured, we will measure usually at 1 month, 3 months, 6 months based on whatever you want to study. So we should have a very clear research question. So what are the sources of research questions? How do you start with a research? So work of others in the area of interest. You should do a literature review. So most of the times when you read a journal, the last 2 or 3 paragraphs gives an idea what are the limitations of the research, what the authors have done and what can be done in the future. So that is a source to start a new research. We can look into that. Whenever you are reading a journal, you can do an analysis of that portion and then look for new things which can be done in that field. And also to being alert to new ideas and techniques, attending research meetings and conferences, getting new ideas, some new techniques or surgeries which you can learn and then apply in your research, and having a skeptical attitude about prevailing beliefs. You should not always believe whatever is existing today may not be true today, might change in the future. So always you should examine the prevailing claims to ensure that there is sufficient evidence to support them, and applying new technologies to the old issues. We had OCT for macular pathologies for a long time. Now we have the OCT-A. So same macular pathologies we can go ahead and do studies with OCTA. So this is applying new technologies to old issues. So research questions can be 2 categories. Descriptive, it involves observations to measure the quantity. There are no comparison groups or interventions. So if example will be what are the morphological macular changes occurring after pars plana vitrectomy and what are the predictors. So there is no comparison group, it is just an observational study. Or it can be an analytical study. It involves comparisons or interventions to test a hypothesis. Like if I compare 2 concentrations of nepafenib, 0.3% or 0.1%, is one better than the other, or they have same effect in treatment of diabetic macular edema. So this will be an analytical research question, and the study will be an analytical study. So something we should remember during doing a research, the planning stage is very important. So always we should have a very good teamwork. If you are resident with the mentor or your guide, you should discuss properly what are you going to plan, how are you going to plan, do a good research, literature search, and then come to a good research question and plan the research properly. So again, 3 stages of review are essential. Scientific review. So the research whatever you are going to should have some novelty and rationality, and which also should be justifiable. And if human subjects are involved, ethics review is needed, and regulatory reviews are mainly needed for foreign fundings. And if you have to send any samples from abroad, or you have to import any samples, we need all these regulatory reviews. So as I told, there should be adequate justification to conduct the research, And we should also have an adequate sample size, and we have this software which most of us use, OpenAP, for cross-sectional cohort and clinical trials, and the sample size should be representative of the population so that it can undergo pass the test for actional validity or generalizability, and should have an adequate power so that the sample size, whatever we are going to study, that should be able to draw some meaningful inference. Usually we take 80% power in general. So as coming to the study design, it can be a qualitative study or a quantitative study, it can be observational or experimental, or it can be a retrospective or prospective. So these are the basic things. If there is any exposure is assigned, it will go for an experimental study. If no observational, if there are comparison groups, it will be analytical. No comparison groups, it will be descriptive. Again, in analytical, it can exposure to outcome, it will be cohort study. Outcome to exposure, it will be case control study. If both exposure and outcome are studied at the same time, it should be a cross sectional. So all these things at the beginning of the study, we should be very clear. What are you going to study? The study design is very important. So you should understand as well as research. When you are doing the research, these study designs are very important. So what are the applications of health research? Why do we need do research? Getting additional or new information, verifying and confirming available information, explaining cause and effect relationship, testing new drugs, vaccines, tools or interventions for prevention, or evaluating ongoing programs and assessing feasibility of new programs. So what are the other advantages for career advancements, academic promotions and recruitments, establish experts in the respective field, gain recognition for the work. So you all know in all medical institutes for faculty promotion we need a basic at least 4 research publications as a professor, and also this has to be indexed in some Medline, PubMed or other related indexing basis, and only original papers, meta-analysis, all these are important. As associate professor also we need at least 2 research publications. Then professional recognition, once you publish a journal article in a journal with good impact factor, that helps to raise funds for future research and helps to collaborate with research from within the same institute or with different institutes. So again, research also helps to generate future research ideas by identifying gaps in the literature or suggesting new directions for research. So professional development, as I told, again, while you are doing the research, you have to go through thorough literature review, understand the research methodologies, and it helps to develop the skills. Also, impact on the societies will be new discoveries, technologies, and understanding. So, one thing, even for the residents, we want to know that for their PG examination, they have to either have a poster presentation or poster podium presentation in a concerned specialties conference, or a paper publication or acceptance has to be shown at the time of their exam. So one more important thing is we should also remember ethics in research and publication. So there are few at the beginning only, mainly the residents should understand these concepts: data fabrication and falsification. So fabrication is data manufacturing, which should not be done at all. If you have not collected the data, you can just think that this is not there. So we have to look for alternative methods to this thing. Then plagiarism is another thing. While you are publishing, you have to look for it, direct and self plagiarism. And authorship things also you should remember. Just last 2 slides. So we should remember ghost authorship, guest authorship and gift authorship. So these things also, as beginning of your research career, you should remember all these concepts and try to understand. And then conflict of interest, anything is there, we should disclose that at the time of publication. It can be financial, personal or professional. And other research related ethics are simultaneous submission should not be done, duplicate publications, self-citation should not be done, and splitting the same work into multiple publications also should not be done, which is known as salami publication. So research misconduct, the consequences can be very severe, like there can be retraction of the journals. In this one of the studies you have shown almost over 20 years it is in ophthalmology, some 87 journals were retracted, and most of them are because of the research misconduct which I have told. Okay, so to summarize, we should concentrate on ethical research and publications. Thank you.
Thank you for giving us a very wonderful insight onto the path of ethical research and what are the pitfalls that could be associated with falsifying data. Sir, any comments? Dr. Parth?
So Amit, your postgraduates all do research,
Yes.
right? So the practical problem comes, what topic, what subject you give them, number one. Number two is many institutions, the mentor gives them a subject that's already either been published or maybe just a little bit of area of work can be done, and it does not become any source of major publication and cannot also because some amount of data has already been published. So how do you choose your subject, number one, and number two is how do you get your people to work on the research?
Yes, sir. As you told, when at the beginning of any thesis, we always should think what will be the final outcome. As you correctly mentioned, there is no point just doing a research for 2 years. The resident will be doing at the time of the publication, it will be an outdated research, then doesn't make any sense. So, as I will suggest the residents to go back and read some journals. We'll suggest them some articles, go through that, try to understand. And as I mentioned in my initial part, the last 2-3 paragraphs of any journal article is very important. What are the things, which are the lacuna in that study, and what can be done in the future. So after knowing that, again we should also see in my setup, in my hospital, if these facilities are available. So these two things are very important whenever, this is the thing which I tell all of my residents whenever you are allotting a thesis topic. Thank you, sir.
Also for the post-graduation, the data that is already available, a particular study has already been done. Such a similar study can be repeated by the student just to know whether the outcomes are the same in our subset of the patients. That will be a safe study, I feel.
So it is a basic
Basic,
part of
yeah.
research which was
As you said, the outcome, you should be anticipating a particular outcome, not that after 2 years the PhD is left in the lurch.
So if the dimensions of research which are present are basic, the literature review, which you can always do at any point of time.
Yeah.
So that is it. Thank you, sir.